The Premier and our government have been clear. When it comes to your health, the status quo is not working. Too many people are waiting too long to get an appointment or surgery, having to travel too far to get care, and spending too much time trying to navigate our healthcare system. We cannot accept this. We won't. We need to be bold, innovative, and creative. We need to build on the spirit of collaboration on display across the healthcare sector. We need to have the courage to look to other provinces and countries and borrow the best of what the world is already doing. And we need to be clear. Ontarians will always access the healthcare they need with their OHIP card, not their credit card. Community surgical and diagnostic centres have been valuable partners towards our pandemic response and addressing the surgical backlog. That is why we are taking further action and releasing a 3-step plan. A plan that speeds up how quickly people are able to get publicly funded surgeries and procedures using their health card. Step 1 will urgently address the existing backlog for cataract surgeries, which has one of the longest wait times. New partnerships with community surgical and diagnostic centres in Windsor, Kitchener-Waterloo, and Ottawa will add 14,000 additional cataract surgeries that will be performed each year. This number represents up to 25% of the province's current cataract waitlist and accounts for the estimated COVID-related backlog of cataract surgeries. We are also investing more than $18 million in existing centres to cover care for thousands of patients, including more than 49,000 hours of MRI and CT scans, 4,800 cataract surgeries, and thousands of other procedures. This bold action will help us clear the entire pandemic backlog for these procedures by March of this year. Step 2 will see the scope of community surgical and diagnostic centres expanded to address needs on a local level with a continued focus on cataracts, as well as MRI and CT imaging and colonoscopy and endoscopy procedures. This will help allow hospitals to focus their efforts and resources on more complex and high-risk surgeries. Step 3 will see the introduction of legislation in February that, if passed, will allow existing community diagnostic centres to conduct more MRI and CT scanning so that people can access publicly funded diagnostic services faster and closer to home. This next step will also expand surgeries for hip and knee replacements starting in 2024. If passed, this legislation would strengthen oversight of community surgical settings so that patients can continue to receive the health care they deserve and provide the province with more flexibility to continue to expand access to more surgeries and further reduce wait times. As we work to shorten wait times, Ontario Health will ensure that these centres are included in regional health system planning. We will also continue working with our health system partners to ensure that this truly is an expansion of services and that staffing resources remain available at our publicly funded hospitals. This plan will boost the availability of publicly funded health services in Ontario, ensuring that Ontarians currently waiting for specialized surgeries will have greater access to world-class care where and when they need it. Bold solutions are necessary to improve the healthcare system as we know it today. Receiving an early diagnosis or a surgery earlier than expected can have a life-altering impact on a patient's life and treatment path, which is why we will continue to work hand in hand with our partners to make it easier and faster for you to receive the surgeries and treatments you need when you need it. It's time we put you back in charge of your health.